And welcome to our Journey of a Living Donor webinar. So this is going to be a whistle-stop tour of what it's like to donate a kidney, the key procedures and steps leading up to donation, and then we're going to hear firsthand from one of our volunteer ambassadors about their lived experience. The aim of this webinar is just to provide some clear and accurate information for anyone considering becoming a living donor, and to support informed decision-making process by outlining the full journey from preparation, surgery, and then after the recovery, and to share some lived experiences, offering insight into someone who has also been through it themselves. So firstly, we're going to be joined by Lucy and Chantal, who are going to be taking you through the pre-work.
Hi everyone, I'm Chantal and this is Lucy. Just wanted to say thank you to Georgia first off for inviting us to take part in this webinar. So myself and Lucy, we are live donor coordinators. We do coordinate, that is part of our role, but we are qualified nurses. We're part of a team of 3 in Cardiff, and we also work closely with another coordinator up in Morriston Hospital. So if you aren't local to Cardiff, you can be seen in Swansea. So we wanted to discuss a little bit about our role first. So our role is to look after anybody who wishes to come forward as a potential living kidney donor. We're not here to find kidneys for anyone. We are here to look after patients who come forward to donate, to take you through all of the tests and to support you through all of those. And that's the key word really. Our main role is support. So we are here to support you whether you decide to donate or whether it's something that you, having had all of the information, no longer feel that it's suitable for you to go through with. We know that can be quite a difficult decision with family to say that you don't actually want to proceed, but we're here to support you every step of the way. So to start off, what we might do is explore a little bit about what's piqued your interest in living kidney donation. It might be that you have a family member who needs a kidney, or that you just want to donate altruistically to a stranger. So we might look a little bit about your motivations around that and your knowledge about kidney donation. What we also might do is find out what you know about the other treatment options for kidney, people with kidney disease. So dialysis, there's a couple of forms of dialysis, and transplant, which we must stress is a treatment option. It's not a cure for kidney disease.
So when we first meet you, you come in and we get to know you a little bit, and then we can start by talking you through the workup. And you can see on my right-hand side, there's a diagram which shows you all the steps. And all of these steps we put together to help us understand if it's safe for you to give a kidney, and if it's safe for your recipient to receive a kidney from you. So all of these tests together help us build a picture of what your general health is like, and that we're not going to cause you any harm by going through the process and going through with living kidney donation. So we want to look at things like your blood group and your tissue typing, and that gives us an idea of compatibility. That's a really complex kind of thing, and we've got really clever people in the Welsh Blood Service who know that kind of in and out, but essentially that guides us as to what type of donation you could do. So sometimes we donate directly, sometimes we do it through the sharing scheme, which is more of a kind of pool where you exchange with other couples, or sometimes we do kind of blood group incompatible transplantation. They're quite kind of unique once we kind of get a chance to talk to our colleagues in the Welsh Blood Service about that, and we'll guide you about what we feel is the best kind of pathway of donation for you and your recipient, and what's the kind of least risk associated with that. And again, you know, like Chantal said, it's your journey. We're here to kind of guide you with that. It's not ours, it's yours. So we kind of support you and kind of keep you informed as we kind of move through it. Some of the other testing looks at your kidney function. So it tells us what the kidney function is of both of them together and how you would likely cope with just one kidney left behind. And that we'd give your recipient enough of a kidney function as well to have like a nice, happy, healthy functioning kidney after the transplant. And again, that's to make sure that we're not leaving you poorly, or, you know, increasing your risk of becoming poorly or having kind of symptoms associated with kidney failure in the future. We look at your CT scan, have a little look at what your anatomy looks like, make sure it's safe, it's not too tricky anatomically to do the surgery. And, you know, sometimes as we go through the process, we do find things that we weren't expecting. And it's almost like we're looking for reasons that you can't donate as much as you can, which sounds a little bit counterintuitive. But with these tests, if we find something that we're worried about, we do have a duty of care to yourselves to make sure that you are that we've explored everything, that, you know, you don't have anything sinister that we're worried about that might be a risk for your recipient. So we have a duty of care to kind of follow up with anything that we're unsure about, which we do quite thoroughly. So it's a very, very thorough process. And once you've had all those kind of appointments, you get the opportunity then to meet with a consultant transplant nephrologist to talk about your workup. They've got really clever kind of graphs and information about what your risk individually might be of developing kidney disease in the future. We know that if you've got somebody kind of close within the family, that might put you at increased risk, and they'll talk through that with you. They'll talk to you about your motivations, about life with one kidney afterwards and what to expect from that. And also you'll get to meet a consultant transplant surgeon who'll talk you through the surgery, what to expect from the day of surgery, what to expect afterwards in the immediate aftermath, and kind of talk to you about which kidney they think is appropriate to retrieve and why they've kind of made that choice. And the other thing to make you aware of is that at each point we do have a live donor meeting where we discuss all the results to make sure it's safe to move on to the next set of testing. But also before you get signed off as fit for transplant or fit for donation, it gets discussed with the main transplant multidisciplinary team. So there's lots of surgeons, lots of nephrologists on that. So it's never kind of one person's decision. It's a very multidisciplinary approach. And, you know, we've talked a lot about the kind of physical side of it, but also we have a psychology team who are dedicated to kind of supporting the psychological aspect. We don't underestimate how difficult it is having a family member with a chronic illness. That can be really difficult for family members and for that patient to live with. And so we offer a lot of psychological support. Sometimes going through this process throws up a lot of feelings. It's not always an easy thing to go through. And so we kind of will refer people on to psychology if they feel it will be helpful. And sometimes even if they don't think it will be helpful, you know, we might make that suggestion to people just to make sure that we are looking after you holistically, that it's not just about you having a cracking kidney, that actually emotionally, psychologically, this is the right thing for you to do. And as Chantal kind of said at the beginning, at any point at this kind of pathway, we support people if they go, do you know what, something has come up, something's not quite right for me. We'll support you to step off that programme if it's not quite right for you. But equally, if it's the right thing, we're with you all the way through to the very end, to the day of surgery, and we pop up and see you on the ward. So that's a kind of, in a nutshell, the workup process.
I'll quickly mention about the Human Tissue Authority as well, because it's there on the slide. So we are governed by the Human Tissue Authority. They give us our licence to perform living kidney donations. So before any donation goes ahead, we have to have their approval. So there will be an interview process, kind of at the final stages, really, after you've had all of your workup and we've got a theatre date planned. 2 weeks before that, we'll ask you in for final preoperative checks, and we'll do the Human Tissue Authority interview at that stage. And we say interview, but we must stress it's nothing to worry about. It's quite an informal chat. We've got two lovely ladies who come in to do those interviews. And they're basically checking, we've done our job, we've given you all of the information you need, that you understand the process you'll be going through. So they might ask you a few questions around the operation, just to gain an understanding of what you understand about the operation itself. They also need to make sure that you are who you say you are. So you will need to provide photographic identification. You'll also need the full copy of your birth certificates, which people put in a drawer 20, 30 years ago and you never see again. So make sure if you are going through the process, you have got a copy of that. They'll also ask you to prove that if you know your recipient, that you've got an established relationship with them. So they might ask you to bring in some photographs to show that you spend time together, or messages to show that you discuss things other than kidney donation. They're there to make sure that nobody's paying you to donate a kidney, that nobody's coercing you, and again, nobody's putting any pressure on you. So what they do then, they'll write up a report, and then that goes off to the HTA. And as long as they're satisfied, we get an A4 piece of paper saying, yes, they approve the donation and everything's good to go ahead. Touch wood, we haven't had one that's not been approved so far. So yeah, so that's probably the final thing. We'll let Mike take you through the operation.
Amazing, thank you both. Just before we move on to Mike, does anybody have any questions for Lucy and Chantal at this point? I can see that there are no questions so far in the chat box. Okay, we'll move on to Mike.
Great, thanks, Lucy and Chantal. So, so we're at the point now where you've been signed off as suitable to donate your kidney, and we're on the ready to go with a date for surgery. So, the way that we do this, you'll be admitted to the transplant ward in Cardiff to T5 the evening before the date of the surgery. So, you're going to have an operation on a Monday, you come in on a Sunday. If you're going to have the operation on a Wednesday, you'll come in on the Tuesday. The night before the surgery, there's a few important things that we do. We need to just double check all the paperwork, the consent process, and all that kind of thing. We need to make sure that we've marked the correct side, which kidney we're going to remove. It's actually usually the left kidney that we remove. There are some anatomical reasons for that based on how long the vein is to the left kidney, basically. But so we will more commonly remove the left kidney than the right side, but we need to make sure we've put a clear mark on you to identify that, and we'll do that usually the night before the surgery. And then you'll need to have an injection of a blood thinning drug. So it's called heparin, and that's a drug that just helps to reduce the chance of you developing blood clots in your legs after the surgery, which overall reduces your risk of complications quite substantially. And then the final thing is you'll have a little drip put in the back of your hand and some fluids given through a drip overnight. And this is purely to make sure that you're nice and hydrated and that kidney's nice and healthy and in optimal condition when we go in and remove it. So the day of the surgery, then it's a nice early start. You'll be up. You'll have a shower with some special antiseptic shower gel, which just helps to reduce the risk of infections. You'll go down to theatre sometime between 8 and 8:30 in the morning, usually. And we try to get things started as quickly as we can. Now, if the donation involves other transplant centres, so if it's part of the kidney sharing scheme that Lucy mentioned, where we're swapping kidneys with other centres, occasionally it's a little bit later than that because we need to coordinate to make sure all the centres that are involved are starting at the same time. Everybody's ready and there's no issues. So occasionally it's a little bit later than that, but normally sometime between 8 and 8:30. Take down to the theatre suite. You'll go into the anaesthetic room where the anaesthetist and their team will look after you. They'll quite often they'll do a little injection into the back, which will help with some pain relief for the first 24 hours or so. It's like a bit like an epidural that you have if the pregnant ladies have when they're giving birth. Very, very effective way of giving pain relief, which means that we don't need to give you too many other drugs afterwards, which then those drugs can have side effects. So it's a really good thing. Not everybody has it, but most of our patients do. You'll then you'll have a general anaesthetic then, so completely asleep, take you into theatre. The first part of the operation is actually positioning you in the right position, slightly on your side, so that we can actually get access to the right part. So that because you're going to be completely asleep, we need to make sure we've got you positioned in a way that's not going to cause any pressure on any areas, not going to cause any problems. So we take quite a lot of time actually positioning you really carefully, so that we can get the appropriate access. The the operation itself we do predominantly through keyhole surgery, so mainly with through some tiny little cuts on your tummy. Um, we do, of course, need to remove your kidney though, so we have to do a slightly bigger cut to actually do the removal of the kidney. And your kidneys are about roughly the same size as a fist. That's roughly how big your kidney is. So we take advantage of that, and actually the surgeon who's going to be doing the operation will make the cut about the width of a fist on your tummy, on the lower part of your tummy, usually around the bikini line, so it's quite low down on your tummy. Then that surgeon will actually have put his hand through that incision right from the start of the operation, and then operate the keyhole instruments with his other hand. And what that then means is the operation is a little bit quicker because the surgeon's got one hand inside, but also a little bit safer because if we do encounter any problems, we've got a little bit of extra control. And it also means that when we're ready to remove the kidney, we can do it nice and quickly. Because what we're looking for is to go from the kidney being happily in your body with oxygen flowing to it through the blood, and we want to remove it nice and quickly, cool it down really quickly, flush the blood out of it, and replace that with some special solution, special fluids that preserve the kidney and keep it nice and healthy for a few hours while we're getting ready to do the transplant. So that the actual operating time is probably only 2 hours in total, but the anaesthetic time is probably about an hour, and positioning often takes 20 minutes or so. So it takes quite a long time, and most of that is not the operating, or at least a lot of it is not the operating, it's the other things. Once we finish the surgery, then we'll have two consultants involved in this. The one who's doing the actual retrieval part, doing the actual operation, and then we'll have the surgeon who's going to be doing the implantation of the transplant later in the day, and they will take the kidney off the operating surgeon, cool it down, flush it out with the special fluid, and then they'll put it into a box a specially designed box that's surrounded with ice, basically to keep it nice and healthy, and wait for us to get ready to do the transplant. So once we're all done, we'll wake you up, take you around to the recovery room, usually spend an hour or so in the recovery room just while you're getting your senses back, and then we get you back up to the ward. So you usually back up on the transplant ward early afternoon for most people, early to mid-afternoon. You'll probably be feeling fairly sleepy at that point, but most people feel very good. Not usually any pain at all at this point, particularly if you've had the epidural injection. And you're able to eat and drink and things as soon as you want to, really. For most people, it's kind of an hour or two after they're back on the ward, but we're guided by you on that. You eat whenever you feel like it. We'll have some fluid running through the drip, probably overnight, the night of the operation, just so you don't have to worry about drinking if you don't want to. And you'll have a catheter tube in your bladder as well, which we've put in during the surgery. That just stays for the night of the operation. That's it, and they'll be out first thing in the morning the day after. So the first day, usually a bit sleepy, nothing else too exciting. When your recipient, when whoever's had the transplant is back up on the ward, we'll let you know. We'll let you know how it's all gone, so that you're informed of things. Assuming, of course, you're not an altruistic donor. If you're an altruistic donor, then we won't necessarily have information about the transplant because the kidney probably has gone to a different centre. So we probably won't have information on the same day, at least, to give you. But we'll keep you updated as much as we are able to. Because obviously that's the main reason you're doing all this. You want that transplant to work. So we're well aware of that, and we will keep you in the loop as much as possible. Following morning, then the first day after the operation, catheter out early in the morning, and then we'll be looking to get you up and moving around and out of bed, eating breakfast, and just generally getting on with things. The first day afterwards, most people are feeling pretty good. Pain isn't normally a massive issue. Occasionally, we need to tinker a little bit with a pain relief medication, but for most people, it's not a big problem. And it is just about trying to get you back up onto your feet and moving around as normal and looking after yourself. You go home from the transplant ward when you're feeling up to it, really. There's not, we'll know by the following morning, usually if there's been any complications, which aren't very common, fortunately. But by the following morning, if all is well, it is just a case of getting you back on your feet, really. And we're guided by you and your home circumstances as to when it is that we get you home. We've had a couple of people who go home on the first day after the donation. That's not the norm, but it has happened. Most people, it's sort of the second or third day after the operation that they go home. But it's not a race, and it's more about when you feel ready. You stay as long as you need to, but you are in the main, you're going to be better in your own house recovering. So that's what we look to try and do. The one of the things that is not uncommon after this type of surgery, there's a couple of things that we sort of commonly encounter. It's not a complication as such, it's just what we see with this surgery. Patients often describe some pain in their shoulder, which it seems a bit weird because we haven't been anywhere near your shoulder. And it's not actually about how we positioned you in theatre either. It's an unusual thing where the to do this operation, we have to blow some carbon dioxide gas into your abdomen to create a bit of space so that we can do the surgery, and that sort of stretches up your abdomen a bit, and it also stretches up your diaphragm a little bit, and your diaphragm is not used to being stretched, and the nerve that supplies the diaphragm also runs to your shoulder. If you irritate that nerve, your brain will assume it's your shoulder that's hurting because there's no logical reason why your diaphragm should hurt. So your brain will tell you it's your shoulder that's hurting, even though it's not your shoulder. So that's very common after this type of surgery, and any type of keyhole surgery, actually. It's very common. Often lasts for a few days, maybe a week, even a bit longer sometimes. It will get better. It's nothing to worry about, and it's just one of those things that sometimes pain relief helps, but often it's just a case of time. And then the other thing that is relatively common after this surgery is a change in bowel habit towards constipation. Couple of reasons for that. Partly, we do have to move the bowel to one side to get to the kidney. The bowel often goes a little bit sleepy after we've done the surgery. And the second thing is some of the medications, the pain relief medications that you'll likely need, have constipation as a side effect from it. So not uncommon for you to be a little bit slow with the bowels after this surgery. And we'll be asking, we will ask you about it every day that you're with us on the ward. It's not that we've got some kind of weird bowel obsession. It is that it's a common thing, and it can make you quite uncomfortable if we don't keep on top of it. So we try and give you laxatives ahead of the time, and you often have some afterwards as well. Again, it'll settle by itself once the pain relief tablets are stopped and once you're kind of back moving around normally and eating normally and things. So, but it may take a week or 10 days or so for that to settle down. So that's in brief is the surgery. I'll happy to take any questions if you've got any. If not, can probably go on to Chantal and Lucy to tell you what happens afterwards.
Thank you for that, Mike. I'm just going to give everyone a few minutes to potentially jot any questions down in the chat box function. No, okay, Lucy and Chantal, so with you.
I'll just say we can't take any credit for these really good slides. Our colleague Suzanne in Swansea, she was supposed to be to present here, but she's poorly, so we've got us again to talk about the next bits. So this is just what to expect in the post-operative period. So a few kind of to-do and not to-dos. Drink plenty of water, make sure that one kidney that's left is well hydrated and that you're keeping it nice and well perfused. Keep active. It's about doing it at your own pace. I think something I've learned from speaking to other coordinators across the UK is I don't think there's like a kind of standard of how long it should take, because everybody's different. Everyone experiences pain differently. Everyone has different, recovery times. So like Mike said, it's not a race. It's about doing it at your own pace. But also, we don't want dying swans on the sofa. It's up and moving, and that will help reduce your risk of things like infection, helps reduce the risk of blood clots, things like that. So actually being up and moving around at your own pace is really, really good, even if it and just make sure that you're not straining, you're not hurting yourself. Your stomach muscles have been cut. It might take a bit of time for that to kind of recover in terms of that. So we know that drugs like non-steroidal anti-inflammatories, things like ibuprofen and naproxen, kidneys don't like terribly much, so we wouldn't encourage that they're used routinely. I think now and again is okay, and using it as a kind of topical gel is okay as well, but we certainly don't want to see it kind of regularly used. No heavy lifting or driving for 4 to 6 weeks post-op. The reason for that is you've had your tummy muscles cut. We don't want any risk of hernias. The last thing you want to do is recovering from a kidney being retrieved and then have to come back in and have a hernia fixed as well because you've overdone it in the first couple of weeks. Gym, kind of building it back up slowly again. And like I said, everyone is different. We have some people calling us 2 weeks after surgery and they're itching to get back in the gym, but it's just taking it slow and letting your body have that time to recover. Contact sports can be picked up after you've fully recovered, and that's fine. And if you go to the GP for anything that you might need, it's letting them know what your history is, that you've donated a kidney, so that they know to kind of be aware for any kind of medication adjustments they might make. And it's also helpful for them to know, because occasionally we get really kind of freaked out GPs that go, oh my goodness, this person's in kidney failure. And it's not that, it's just that you've donated one and they haven't actually put it in the context of donating a kidney. We would expect initially for that function to not be within the normal limits because you've donated one and you've lost half of your function. So it's just important to let them know so they can kind of contextualize what your blood test might mean should you go to the GP. So after you get discharged, we will arrange to see you back in clinic in Cardiff 2 weeks after the surgery, where one of our surgeons will have a look at your tummy, check that the healing is going okay, check that there's no hernias, nothing exciting going on there. But very much in the same way that after, I don't know if anyone has had a baby before, and you get discharged from gynecology and they say, if you need anything, you call us within the first couple of weeks. We have the very much same philosophy here. So if people have any concerns about wound infections, have any concerns about lumps or bumps, they feel like the pain is quite disproportionate, you can give us a call in clinic at any time and we can get you in before that 2-week appointment. If you're really concerned, you can always call the ward for any advice that you might need in that kind of 2-week post-op recovery period. And we'll check your blood pressure and everything else like that at that appointment. Can you move on to the next slide, please? I don't know how to say that without sounding. Next slide, please. Or is it not moving? Oh, there we go. So, return to work. We would expect you to take about 12 weeks off work. Again, it's very subjective. Some people are itching to get back to work at 8 weeks. And I think as long as you're kind of not terribly active in work, you don't have a really kind of manual laboury type of job, 8 weeks for some people is absolutely fine. I think the other thing to kind of remember is that it's not always the physical side of it. Some people feel quite tired. It's not unusual that we'll feel quite a lot of kind of lethargy, particularly in the 8 weeks. Quite often when we see people, they say that it's the 6 to 8 weeks that they feel like they've turned a corner and they've gone back to kind of their normal selves. So I think the key message is not to rush. And just to kind of note that we will reimburse people for any loss of earnings that they might have in that 12-week period. We wouldn't expect people to take 12 weeks off with no pay, because that's a totally unrealistic thing to expect. So as long as you provide us with the kind of financial information, we'll guide you about what you need to provide. We'll make sure that any loss of earnings that you might have by having that period of time off are reimbursed by the Welsh Government to make sure that you can have that time to recover. Usually by the time we see people at 12 weeks, so that's when you get to see myself, Chantal, or Susie. We're the three in Cardiff. Often at that 12-week appointment, that's the kind of check before you go back to work full time. So we'll do your blood pressure, your height and weight, and check that you're back to kind of normal level. A bit lethargic, a bit tired, that might take a little bit longer. But we'll support you if you need kind of longer time off work. We can signpost you as to how to kind of arrange that. You also get lifelong follow-up with us. Mm-hmm. So you see us at the 3-month and then at the 9 months to bring you in line with the year of donation, the kind of year anniversary. But then if you're kind of West Wales way or Swansea way, we can refer you back to Suzanne, who will follow you up down there. And we see you every year. We check your blood pressure, we check your weight, your height, and we check all your bloods and check that everything's doing okay. The benefit of that is that we can keep an eye so that if, for example, your blood pressure starts to creep up a little bit, we can treat it. We can get things done early, and we can make sure that we're kind of catching things before they become too much of a problem. Move it on, please. Thank you. So these are what we check. Urine tests as well, I didn't mention. We'll check to see if there's any protein in your urine. People sometimes worry about coming to see us. They feel that we're kind of the weight police, which isn't very nice. We're not here to shame you if you put on weight. Life happens and we all fluctuate in size and everything else. But I think it's just that we're trying to encourage people to stay as healthy as they can for the sake of that one kidney that is left. We want to protect it and look after it. And we know the best way that we can do that is by keeping your weight down, because that reduces your risk of developing things like high blood pressure and diabetes, both of which your kidney won't thank you for. And just making sure that you're, active and living a healthy lifestyle like any other member of the population. She's put some statistics in here as well about the risk of developing blood pressure medication. Sometimes what we find with people, as their weight goes up, they might need a bit of medication to support with their blood pressure. But if they lose that weight, they might not actually need that anymore. So it's kind of monitoring that and supporting people with that. Have the next slide, please. Something that we look at as well, which might be of no, interest to some people, is fertility, particularly with women. I think because, the pressures on your body of carrying a baby, we are quite mindful of women who are of childbearing age, who perhaps haven't had children yet or haven't finished having their families yet, but there's someone that they would like to donate to. I think it's to reassure that people can go on to have totally uneventful pregnancies post-kidney donation. But again, it's one of those things that's really important that you share that with your midwifery team, and they'll be able to keep a closer eye on your blood pressure, particularly if you have other risk factors that might put you at risk of higher blood pressure, things like preeclampsia. But I think, on the whole, people will go on to have really, like I say, uneventful pregnancies. It's something that you can discuss in more detail when you meet the transplant nephrologist, and it's something we will go over with you and make sure that it's, the right time for you. The other thing to remember is your kidneys aren't going anywhere. So if you want to postpone donation until you've finished your family or kind of done that side of it, we'll support you with that as well. Can I have the next slide, please? Thank you. And the long-term risks, I think this is really interesting. It's something I learned when I started in this job, is that the studies tell us that people who've donated a kidney live longer than people who don't. And that's not because they've donated a kidney, but it's because they're in a really healthy group of people. They're a really healthy population, because if you weren't, you wouldn't be allowed to donate a kidney in the first place. And I think it's important to remember that actually life afterwards, people often ask, can I live like I used to? Can I drink alcohol? Can I do all of these things I used to do? And yes, as in, as per the government guidelines with your alcohol intake, of course. But it's, it shouldn't impact on your life in the long term. There are, of course, risks that come with that, and we'll talk you through all of those potentials. But on the whole, you look after yourself the way we would want anybody in the general population to look after themselves. Keep your weight nice and healthy. have a nice, healthy, balanced diet, and keep yourself active. You know, those are things that we all should be doing to look after ourselves when we have two kidneys or one. Next slide, please. So this is just a story that Suzanne put together. This young lady donated to her father, and I believe she went on to have 2 uneventful pregnancies afterwards, which kind of reinforces that that consideration about babies post donation. So I'll let you have a read of that. Very generous of her to share her story.
Shall I answer that question there in the chat? Helen's asked, will pre-existing high blood pressure affect your ability to donate? It can do. It depends. What we would look at is how well controlled is your blood pressure, and how many blood pressure medications you might already be on. So we would consider somebody who's got well-controlled blood pressure and maybe on 2 medications to control that. Some people come forward and their blood pressure is controlled well, but they might be on 3 blood pressure medications. And that doesn't really leave us anywhere to go after you've donated if you do develop uncontrolled blood pressure. So probably being on 3 agents for your blood pressure would rule you out from donating. But if you're on 2 or less, we can suggest lifestyle factors as well to bring that under control. But yeah, because we could add another agent in after, we would still consider you. But obviously it would be subject to all of the other tests we have to put you through.
And if you go on to the next slide, I think that takes us nicely to Wendy's journey, which I won't say anything about. Has anyone got any questions about the kind of post-op period?
Oh, Helen, yes, you should be fine with that. Yeah.
Amazing. Thank you both. In which case, we'll hand over to Wendy now, who can share her lived experience.
Ambassador with Kidney Wales for a few months now, and I donated a kidney to my son back in December, and so was asked to share my journey of kidney donation with you tonight, hopefully to answer a few questions and just to share our story, really. So our story started back in January 2024 when my son was travelling out in Australia. We had a phone call in the middle of the night one night to say that he'd been found having seizures, had very high blood pressure, and was subsequently diagnosed with chronic kidney disease, stage 5, and so had 6% kidney function when we found out that he had it. So that's where the journey started, really. Prior to that, I had no knowledge of the role of kidneys and how important they were, and that they controlled blood pressure and everything else that they did. Hadn't heard of anybody who was on dialysis even locally to me, and and hadn't talked to anybody who'd gone through the transplant process or anything. So it was quite a shock. We've been through quite a journey over the last 18 months. I can tell you nearly everything that you probably need to know about kidneys now. I've gone through the ringer with it, but yeah, we've got through it. And so just to share our journey, really. So we got back. I flew out to Australia. We got back from Australia sort of 2 weeks after he was diagnosed. We had an appointment in Swansea straight away in Morriston. Spoke to Suzanne that first day. I think we got back from Australia, and we were told that Gethin would need to start dialysis pretty soon. He started in March, actually, with peritoneal dialysis. That worked for a while. He then went on to hemodialysis in about June time. But it was in about March that we started the testing process, really, then. So my husband and I went down for discussions with Suzanne in Morriston, having filled in the questionnaires and so on. Actually, my husband's 3 brothers as well, and my brother, 5 of us put ourselves forward for testing. And 5 of us were a match, actually, which was incredible. One of the first decisions, really, was which one of us was going to go ahead. I remember having the conversation with Suzanne. If we were both a match, it was obviously going to be my husband or myself first. If we were both a match, which one of us was going to go ahead first? And I remember that being a really difficult decision. We both wanted to do it. I really wanted to do it, being as his mother, and my husband really wanted to do it as well. So we had to make a decision. At the time, my husband's BMI was slightly high, and you wouldn't say by looking at him that he was overweight. He's just quite a big, strong farmer type. But his BMI was slightly high, so that was how we decided, really. For me, we're on a farm in West Wales, sort of 2 hours from Cardiff. Quite a lot of manual work on the farm. It would be far easier if I did it, because I've got an office job. Recovery would be easier. So that's how we sort of decided. And that wasn't a decision I thought, that we'd have to take, but obviously it was something that we had to consider. And that's how we went ahead. So I went ahead with testing to start with. Yeah, lots of different tests. I think they've been mentioned. I won't repeat them. Quite interestingly, I visited quite a lot of hospitals in Wales for these tests. I had the chest X-ray in Morriston. I had the CT scan in Aberystwyth. I had the nuclear blood where they put a dye in to see how well your kidneys work. I had that in Singleton. So I have been around quite a few hospitals. And that was one point as well, when the girls mentioned that you're reimbursed for your wages during that 12-week period. You're also reimbursed for the expenses to travel to all the appointments as well, which was obviously very helpful as well. So all the tests went really well. They all came back positive. The kidney function test came back really well. I was really worried. I think it was that I couldn't donate for somebody in my age bracket if it was less than 80, and mine came back at over 110 or whatever it was. So really pleased with all the tests. And so we were then, in about May time, I'd passed all the tests, and we were then referred to Cardiff because the operations are undertaken in Cardiff. So we were referred to Cardiff in about May time, and then just waiting for the appointments then from the nephrologist and the consultant. They sort of happened in July, August time. And then we were waiting for a date, basically. I know things have improved quite a lot now, but at that time last year, they were, there was limited theatre space in Cardiff, so we were waiting a while for a date to come through. In the meantime, then we had the Human Tissue Authority interview. I thought that was, you mentioned that, Chantal and Lucy. That was, I was really nervous for that. I don't know why, because it was interviewing both of us together, then separately, to check that I wasn't being coerced into it. And we'd been told to bring photos to check that we had a good relationship. And the poor lady, I think, had so many of my photo albums by the end of it. She was saying, no more, please. So I think she was convinced that I wasn't being coerced into it. So we had approval from the Human Tissue Authority, and we had a date through for the 4th of December, 2024. So we were given that date about 6 weeks prior to the date. And we were told that we would have a COVID test when we arrived on the ward. So having waited so long for the date sort of thing, I really didn't want anything to go wrong. So Gethin and I isolated for 2 weeks prior to the operation. I know we were told we didn't have to. They said 24 hours or 48 hours, but we did for 2 weeks prior. We didn't go anywhere. We even missed my middle son's 18th birthday party on the 29th of November because I really didn't want anything to go wrong. And so during that process, I would say, I did find a really useful Facebook group for the Living Donor Support Group. Now, I know some Facebook groups you read and you only hear really negative stories. So I would use caution with too many groups and looking things up online. But this Living Donor Support Group was really helpful. And it's run by people who've donated kidneys themselves. Lots of really good information on there, and booklets and so on recovery and the process. And one really helpful lady reached out to me about my age, who donated to her son, which was about Gethin's age, had a really good recovery. And that really helped me in the process in order to have confidence that we would get through it. And the time maybe working up does feel like a very long time when you're in it. And I know for the staff who are doing sort of 2 a week of these, your sort of patients and so on. But for the patient living through it, it does, it does feel at the time like it's a very long time. Looking back now, that year, it's just, it doesn't feel like that anymore. But at the time, it felt like a long time. So just bear with it. You will get there. And by the time things you've moved on past it, it won't feel like the huge sort of weight on your mind that it was at the time. So that was the sort of testing process. All went very smoothly for us, really. And yeah, so we were a match. Obviously, we've got my husband and a few others in the pipeline, because Gethin's so young. He's probably likely, he was only 19 when he was diagnosed. He's likely to need another one. So yeah, the way we've both recovered, though, I would definitely have confidence in, you know, if we needed to go through that again. So next slide, please, Georgia. So just our journey, really, and I won't go on too much about this because Mike has mentioned it, but the night before the operation, so we were admitted on the Tuesday, the night before, the surgeon and the anaesthetist came down to have a chat with us to run through what the surgery day looked like. And that put your mind at ease straight away about, you know, that they were going to look after you, that things were sort of going to go smoothly the next day. So the morning of the operation, I got to see Gethin in the morning. He was actually having a couple of hours dialysis in the morning. So I went over to see him, yeah, had a shower, put on the lovely socks that you need to wear when you're having an operation. And so I was ready, yeah, I think I was ready at about 7:30 to go down. And the surgeon came up to see me actually and said, "Are you ready? And we'll get a porter and we'll take you down." So I did actually go down about 8:30. I think I was back on the ward before midday. Because my husband had gone home, obviously on the farm work to do, and he came back down, and he was hoping to be there before I was back, but I beat him to him back on the ward by midday. Like you said, that day, no pain really. I'd had the injection in the back. I slept a lot after surgery and had no pain at all that day or that night. I slept like a log that night, I would say. At 5 o'clock, Gethin's surgeon came to see us and had told us that the operation had gone really well and that the kidney had started working straight away and that the urine bag was filling with urine before they'd even stitched him up. So it was such good news, such a relief to know that had worked straight away, and that really helped with with recovery. That, you know, that afternoon and night, then it really was a weight off my mind. And then we'll go on to the post then, please, Georgia. So the next morning, I was quite painful when I had to get out of bed. Like Mike mentioned, so they pulled the catheter out the next morning. And the first time I got out of bed, yeah, it hits you. I thought I was going to pass out, but I didn't. And then every time after that, it got easier. And I think pulling the catheter out, obviously you had a drip to put fluids in as well. I had to use the bathroom several times that day. And obviously I think that helps with your mobility and getting you out of bed. Managed fine with painkillers, paracetamol, and I think I had one other painkiller that first day. Didn't have a lot of appetite really that first day. Had a few cups of tea, a bit of toast, but wasn't bad at all. Only getting out of bed was quite difficult, but that's to be expected, I suppose, isn't it? So that was on the Thursday. Then on the Friday, the following morning, so 2 days post-operation, yeah, I was allowed to go home. My sister actually lived quite close to the hospital, and she's a doctor as well, which was quite nice. So I went to stay with her for a couple of days while Gethin was still in hospital, and was absolutely fine, managing pain with paracetamol only. Getting in and out of bed was quite difficult, and sleeping flat was quite difficult as well. I had to be propped up quite a lot, maybe sleeping on a reclining chair was easier for a few days post-op, I would say, but managing to walk around, no problem. Managing to use the bathroom, no problem. Climbing the stairs, that was fine from 2 days post. There was some discomfort caused by trapped wind following surgery, which has been alluded to. I didn't really have the shoulder pain. I just felt really bloated. I felt like I looked like I was 6 months pregnant. And that took that took a couple of weeks to settle down, I would say. Very slow bowels as well. And that used to happen to me before. If I'd taken antibiotics or if I had painkillers for anything, I used to have used to affect my bowels. So that took a while to get over, really. The first 3 weeks, when we did these slides, I felt rough. I wouldn't say I felt rough. I felt uncomfortable, maybe would be the word. difficult to get in and out of bed again. My stomach muscles were non-existent. They had come back, but at the time they were non-existent. So it was yeah, difficult those first 3 weeks. And I'd spoken to another guy who donated a kidney, and he told me after 3 weeks I turned a corner. And I remember thinking I'd got to 3 weeks and a couple of days, and I was like, I haven't really turned the corner yet, but I did in those few days. I really did. I did take it really easy at the start to aid recovery. I was told that I should take it really easy. It was sort of 4th of December, so it was coming up to Christmas. I didn't do anything, basically. Gethin and I binge watched Yellowstone from start to finish. And we got all the family members to bring us food and to do everything. So really, I did take it really easy, and I think it helped. After sort of 6 to 8 weeks, I was back working from home. Really, I had my laptop at home, and starting to feel a lot more normal. And I said, yeah, 8 weeks I was back practically at work full time and feeling absolutely fine. I think during the donation process, I think you do need a bit of, like the girls mentioned, psychological maybe discussions help as well, because I was absolutely determined to do it. I remember having the meeting with the surgeon, Dr. Chokin, I think it was the meeting I had, and he was going through the risks of the operation and so on, and the risks of developing high blood pressure later on. And in the end, he said to me, it doesn't matter what I say, you're going to do it anyway, aren't you? And I was like, yes, I'll do it tomorrow if I could, to see Gethin not have to go through dialysis. Seeing your 19-year-old son on dialysis 3 days a week is sort of heartbreaking. So I would definitely do it again tomorrow. But I think, obviously, I think the only time it hit me was before going down to theatre, in the room before you go in for the anaesthetic. It did actually hit me. Oh gosh, I've got 2 other children as well. If something did go wrong, I hadn't really, maybe that's when it hit me before going in. But obviously, yeah, nothing would have changed my mind anyway. But I think you do need to prepare yourself for, you will have maybe wobbles. My wobble only came it was too late by then. I was going into theatre. But maybe it's good to discuss these things a little bit sooner than that. 7 months after the operation, the team in work, we decided to do a fundraiser for Kidney Wales. So I managed to walk 26 miles of the coastal path as a fundraiser. So obviously no difference to what you're able to achieve. I can still enjoy a glass of wine or two, which the girls alluded to. I did read a couple of things prior to the operation that people had gone off wine after donating. So I was a bit worried about that. But no, all okay with that. Definitely a positive experience. I would do it again tomorrow if I could and if I had to. And like I say, he is likely to need another one probably, but the way we both recovered, I'd have no qualms about allowing another member or encouraging another family member to go ahead with it. So yeah, definitely a positive experience. I don't feel any different now. 9 months on now, I don't feel any different to how I did before. So that's got to be good. Gethin is recovering really well. He's even back playing rugby with permission from Dr. Chokin. And I've even been told part of me now has scored a try as well for the local rugby team. So all good, and definitely would encourage anybody who's got any worries about it to ask the relevant questions, ask your heart away. I found it really helpful to ask the people who donated, and I'm more than happy to answer any questions. Thank you.
Amazing. Thank you so much, Wendy. We have got one question here. I'm not sure if Mike, Lucy or Chantal, if you would like to take this. It is, what about North Wales and what is the age limit? I'm 72 and healthy.
So the process in North Wales is fairly similar in so much as you'll be assessed in your local centre. So each of the 3 big hospitals in North Wales have a transplant nurse attached to it who would be able to start the initial part of the assessment process. Donation itself would happen in Liverpool if you did go ahead with the surgery. There isn't a transplant centre in North Wales, so it would mean a trip to Liverpool. But the processes will be very, very similar. Certainly the assessment is standard. The surgical techniques are very, very similar. Subtle differences between different surgeons, but basically the same thing, and you can expect the same sort of recovery period. In terms of the age limit, there isn't an age limit. It's about how fit and healthy you are. It's all about those aspects really. So I know that it's exceptional, but I know of an 81-year-old who donated a kidney, a live donor. So that's not common, but certainly donors in their 70s are not that uncommon. We do see several of them. It's usually there are factors to bear in mind when we think about age, because for all of us, we lose a little bit of kidney function as we age. It's just a natural part of the process. So an older person donating to a very young person may not always be the right thing, but an older person donating to an older person usually would be acceptable, providing that person was otherwise fit and well. So no issue with age of 72 for sure.
Sham, I've just popped our email address in the chat box there. If you want to email us and get in contact, we can direct you to our colleagues up in North Wales then. If that will be helpful, we're happy to do that.
Amazing, both. Thank you so much. I've seen there is another question in the group. Again, just thanking everybody for sharing the information, and Wendy for sharing your journey. And they've asked, can you advise how they would start the process with the pre-assessment documentation?
So the best way to kind of get going with it, if you're interested, is contacting your local hospital, so either Cardiff or Swansea, were the two centres that do the assessment. You can either drop us an email or give us a call, and we can put our telephone number in the box as well. We'll ask you a few preliminary questions. So we want to know who you'd like to donate to, if there's somebody you want to donate to, or if it's altruistic. We would want to know your height and weight, just so we can understand what your BMI is before we kind of start the workup. We'll ask you if you're generally fit and well, if you take any medications. It's just a very brief kind of understanding. And also, what we didn't mention at the beginning is if you're a smoker. We would need people to be non-smokers for 3 months before we start the workup. That's because smoking, as we all know, is not very good for you. We all think about lungs when we think about smoking, but actually it impacts on your vessels as well. That's something that we don't think about quite so much. So again, it's just another protective measure to safeguard that one remaining kidney after you've donated, if you go through the process. And we know that it takes about 3 months for you to kind of build a habit. So to break a habit, we'll get you off for 3 months, and then we'll see you. And then if all the questions are all okay, if we don't have to have that period of weight loss or smoking cessation, we'll send you a health questionnaire, which is a really comprehensive health questionnaire. So if anybody's donated blood before, there's lots of questions about your general health, any surgical history you might have had, any family history, any kind of time spent in hospital, things about behaviour, so things that might feel a bit personal. Again, it's important to know we're not asking to be nosy, we're not asking to be judgmental. It's just so we can understand your past medical history and make it as safe as we can for both yourself and the recipient. So the first step is to contact me, either us or Suzanne down in West Wales, and we can kind of guide you from there.
Lovely, thank you both. And that's for South Wales. What unit would they go for pre-assessment in North Wales?
I know there's one in Bangor and Wrexham Mailer. Mike mentioned that there's 3. I'm not sure which the other one is.
Yeah, Glenclwyd as well.
Oh, yeah.
So there's a transplant nurse in each of the centres. That in North Wales, the processes are slightly different in each of the 3 centres, but you can have the initial part of your assessment in your local centre. If you're in North Wales, there you would need at some point to go over to Liverpool for an assessment. And similar to the South Wales situation, if you're from West Wales, you can have your initial assessment over in Swansea, but you'd need to come over to the actual centre where you're going to have the surgery for one assessment. So it's quite similar to South Wales, really.
Amazing, thank you. And it doesn't look like there is any more questions in the group chat, other than one just asking for an email for the Cardiff unit. So thank you very much, everybody, for joining us. thank you to all our guest speakers for giving us an insight into that process and what it looks like, and Wendy for sharing her lived experience. We do also have a living donor PDF on the Kidney Wales website, and in there it's a collation really of some different resources that you can use if you wanted to go and have a little read furthermore onto that. If you are interested and did enjoy today's webinar, you can also sign up to Kidney Wales's e-newsletter, where we send updates on any webinars that we have coming up. So thank you, everybody.